Larimer County is committed to the health and well-being of its residents. And that means ensuring that we're protecting the vulnerable, helping people who are struggling become self-sufficient, and ensuring that the entire population is healthy. And although they serve all ages, there's a special emphasis on kids.
A baby that is born healthy has a much better opportunity for a healthy life. When they are given the kind of stimuli they need to grow and develop appropriately, they're better able to succeed in school, in life. There is a real economic side to that as well as the human side.
Since we are able to offer them healthy food and nutrition tips during pregnancy, we are seeing better birth outcomes, less premature deliveries, low birth weight infants. So we can really have an impact there, and it does save Medicaid dollars because there's less health care costs. So if we can help moms with nutrition and health tips early on, it will help their children to develop good food and nutrition habits. There's less chance of them maybe developing diabetes or heart disease later on.
You gotta let go, there you go. Everybody knows when you're around a kid and they get sick. Pretty much everybody gets sick. And if they've got a cold, you know, that's okay. But there's a lot of other diseases out there that can be much more serious for kids.
We do immunizations here for the Vaccines for Children program. Children who do not have insurance, who are underinsured, we want to make sure that no child develops a vaccine preventable disease because they seem to be more susceptible, more prone to complications from diseases.
Keeping kids healthy is one thing, but keeping them safe is also important. Sometimes the stress of life can really push parents and they forget why they became parents in the first place. That's when it's time for the county to step in and lend a hand.
Our main focus is to work with families to keep families safe and to keep children safe in their own communities. We work in a differential response philosophy, meaning that we respond to allegations of child abuse and neglect, working with the family to help keep the children in their home and also give the families and the parents support, because if we are not helping that family, then we're going to be looking for placement for that child. If we don't invest in children, especially when the family's in a moment of crisis, then we're not helping the community.
Families with kids aren't the only ones who need support. The fastest growing population in Larimer County is people over 65, and the Office on Aging has programs to help aging seniors and caregivers as well.
Our system really can't afford to make an assumption that everyone's going to be able to afford assisted living or skilled nursing level of care. And our public assistance programs really can't afford to have everyone go to that highest level of care. Not everyone needs that. So if we start looking at programs, start networking with other agencies and start finding those gaps in services, and as a community address where those gaps are, then as our population ages, it'll benefit the whole community.
While the county works with individuals on many levels, it's the goal of the health department to have an impact on people's lives by improving the health of the community as a whole. So in addition to holding immunization clinics when needed or tracking West Nile virus,
air quality monitoring, water quality, zoonosis, which is diseases spread by animals, inspecting food establishment. We also do a lot of planning, training, and exercising around what we would do public health-wise in a disaster.
$6.
Perfect.
Okay.
Thanks so much. Did you know Larimer County's farmers market was the first farmers market in the county? Larimer County Extension does all sorts of cool stuff, from run the farmers market to 4-H to financial and nutritional education for anyone who needs it.
And Extension is a part of a land-grant university, and our purpose is to bring quality, current, up-to-date information into people's lives, in their homes, into their hands, so that they can make better decisions and improve their quality of life.
The experts at Larimer County Extension work with researchers at Colorado State University to give people access to the latest information.
As the horticulture agent for Larimer County, I coordinate the Master Gardener program, which is entirely volunteer-based, and they receive training and then they do outreach education for the Extension office. I run the farmers market and I do a lot of public education.
In addition to useful information for everyday life, Extension has a lot to offer when there's a disaster, like the High Park fire or flood of 2013.
We gathered current research-based information to get it on our website so that people could access it that way. But we also were at the Disaster Recovery Center the entire time so that we could actually talk with people to help them know how to deal with mold, mildew, treat their wells, deal with food safety issues, trying to reduce the level of stress that they're already dealing with.
When it comes down to it, part of what makes a community healthy is a thriving economy. Larimer County is committed to helping people find great jobs that they love and employers find great employees that can help their businesses grow.
The attractiveness of a community is very much based on the human element, the human capital that exists there and that will grow there. So businesses are looking to communities that have the human capital that allow them to be more competitive in the 21st century economy.
We may be most well known for the services that we provide to our job seekers and folks that are looking for employment, and that's really who walks through our door the most. But we also realize that there is a strong component of supporting and working with our business community so that there are jobs available.
And that's what the Workforce Center does best, work at both parts in helping match our businesses with the trained, skilled workforce they need.
The Workforce Center definitely has a focus in training. We receive federal dollars to help support at-risk youth and laid-off workers and unemployed adults. So the primary point of training is to help people transition into employment if they're underskilled or if they're coming from a layoff in an occupation that is in decline.
So we do work with our community college partners to make sure that the trainings that are available are what companies are expecting and needing.
We bring the companies into the classroom, we do tours, the companies are helping us develop the curriculum. We take our instructors out to visit a lot of the companies to understand how the skills that they're teaching relate back to what's being used out there in industry.
I love the opportunity to help make a difference in a citizen's life by providing meaningful employment or training activities, seeing people go to work.
18% of the budget for human and economic services is from your local property taxes. 82% is from state and federal funding, as well as user fees like 4-H and health department fees.